Last week, the WHO implied that a sticking point was based in UN resolutions that recognise only representatives of the PRC can represent China at the WHO. However, Taiwan's foreign ministry and Taiwanese lawyers say that the resolutions only address the question of China's representation and not the separate issue of Taiwan's attendance. Given that Beijing's One China principle is not international law and not universally recognized, critics of the WHO and the Director General's reluctance to invite Taiwan say that you're making a political call if you fall into line with Beijing's views on the issue. How would you respond to that?
Thank you for the question. There are 5 points I'd like to make to respond to that question. First, the Secretariat works within the framework of rules and policies decided by the 194 member states of WHO. These include the decision you mentioned, the decision by WHO member states made 49 years ago. That still applies, where the Health Assembly decided that the People's Republic of China is the, and I'm quoting here, is the only legitimate representative of China to the World Health Organization, close quote, and further decided, and I'm quoting again, quote, to expel the representatives of Chiang Kai-shek from the place which they unlawfully occupy at the World Health Organization, close quote. Second point is WHO experts, turning to the issue of technical work. WHO experts recognize and have publicly said here at these press conferences and otherwise that Taiwanese health authorities have mounted a very successful response to the outbreak and have good experience to offer. Their technical contributions to WHO's COVID response expert processes, including 3 WHO networks, Clinical Network, the Infection Prevention and Control Network, and recently the Vaccine Network, their work on with the WHO Global Research and Innovation Forum, where they sent 2 experts, and their IHR EIS system connectivity, all are examples of where they have contributed significantly, and their contributions there are appreciated. Third, WHO is premised on the principle that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. This is in the WHO Constitution. It's part of our DNA as an organization. Fourth, the DG, the Director General, is the Secretary of the Health Assembly, according to the Constitution. Member states, and only member states, determine the policies of the organization at those meetings, make the final decision on what they will discuss, and they themselves determine who attends as observers. To put it crisply, Director Generals only extend invitations when it's clear that member states support doing so, that Director Generals have a mandate, a basis to do so. So, for example, the Holy See was invited by the then Director General in 1949 when the Health Assembly was held in Rome. Then in 1950, the ICRC was invited, and then in successive years, a number of examples, the IFRC, the Global Fund, Gavi, among a few others. For all of these, member state support was very clear. And from 2009 to 2016, Taiwan was invited by the then Director General as an observer at the Health Assembly as Chinese Taipei on the same basis. Then, too, member state support was clear. It was clear then because a diplomatically agreeable solution had been found, and member states supported that solution. Therefore, on that basis, the then Director General could and did extend an invitation. Today, however, the situation is not the same. Instead of clear support, there are divergent views among member states, and no basis, therefore no mandate for the DG to extend an invitation. Fifth and final point, a practical one. A proposal has been made by 13 member states now that the Assembly itself make a decision on an invitation. That is procedurally how it is supposed to work under the Constitution. All 194 member states can consider the issue collectively in accordance with the rules of procedure. Member states can also choose to look for a diplomatically agreeable solution for handling this issue. They have done so many times in the past, working cooperatively together. Success on that depends on political will and political engagement, which underscores the point that this is a political issue that is properly in the hands of member states. Thank you.